Welcome to Silicon Valley Asian Business Talk.
My name is Roger Chen, and I work at the University of San Francisco. My field basically is the innovation and a strategy, and I represent basically two centers. So one is, as you can see here, from the, we call it CAPS, University of San Francisco Center for Asia Pacific Studies, and also another center is the Center for Business Studies and Innovation in Asia Pacific. It's also part of an interview program I'm doing for the center. The name of the interview program is called the Silicon Valley Asia Business Talk, where we kind of interview successful Asian business leaders as well as entrepreneurs. So, yeah, Stacey, yeah, please.
So
briefly introduce yourself.
So to begin with, I don't know how I fit in that description you just said, Silicon Valley entrepreneur.
You are part of Silicon Valley, right?
A little bit further up. But anyway, it's a pleasure to be here. Thanks everyone for joining. So my name is Stacey Ma. I'm currently the Executive Vice President of Pharmaceutical Development and Manufacturing at Gilead Sciences, which is a biopharmaceutical company. My entire career has been in the biopharmaceutical company for close to almost 30 years. I spent over 2 decades in another very famous biopharmaceutical biotech company in the Bay Area, Genentech, and then Roche. And then after 20-some years there, I also joined a startup in the Bay Area, Sound Biotechnology, which is a cell gene therapy company, and built up a whole tech ops or manufacturing organization there from ground up. After 3.5 years as Sound Biotechnology, I joined Gilead in mid-2022, so at the tail end of the COVID pandemic era, and I have been there almost 3 years. So it's really a pleasure to be here to talk a little bit about kind of the intersection of technology and biotechnology.
Gilead's strategy for embracing AI and innovation.
Actually, what is the Gilead's approach embracing or thinking about adopting AI?
Yeah, I would just start off. Gilead, as an innovator, always wants to stay current. So very open to innovation. I think so. The foundation of the culture is always open, stay curious, adopt new technology, right? So that's one in terms how we manage new technology. In general, AI just one.
Yeah, right.
The second is in terms of innovation, manage AI as innovation. A lot of what we do innovation, I would say it's kind of, what do you call it, integrated innovation. It's really putting different things together. So it's extremely interdisciplinary in terms of development of a new drug, and then incorporating a new technology and how you develop a drug also has to be cross-functional. So it's always about how do you create that cross-functional working environment, and at the same time you do want to make sure from a decision-making perspective. So it's a lot about cultural element. You have to create that culture, foster innovation, but create that kind of structure to enable that. So that's one, how Gilead managed sort of AI as part of our capability to enable drug development. The other piece is also you need to stay focused on kind of the application. What is it that you're trying to do? So it's not that AI for everything. And then when we also say AI, it doesn't mean it's always generative AI or engine. Sometimes it's just machine learning. So it's really what is that activity you're trying to apply this new technology for? That's really key. So with that, each area will have to figure out what makes the most sense. But then they need to be connected, because otherwise, whatever is the bottleneck is going to slow down everything. So you have to make sure that you create that end-to-end sort of workflow change. And the third piece is, like everything, applying a new technology, doing things differently is a change. So you have to factor in the human element. How do you manage that change? And automation, digitization, it's sort of thing of the past. We've kind of gone through that, but all of that required change management in terms of people, how the people doing the work means they have to learn new skills, and sometimes they may not be able to do the exact same way because you have to change. So that's a huge change management element of how we manage these technology change as well.
Yeah, actually, you already kind of answered some kind of questions I would like to ask later, but since you touched on this, maybe I can ask a follow-up question, because as a professor of strategy innovation, this is very close to what I teach to my students. As you mentioned about the integration, the total solution, and also coordination, this is very, very common challenges many companies face, not only by AI innovation, all sorts kind of change, new initiatives. But how do you deal with those kind of issues, under your management, under your leadership, in a sense?
Yeah, that's probably the hardest part of our job. It's a little bit kind of how do you lead as a technology leader, and versus how do you lead as people organizational leader. In our both space, technology or biotech, you kind of have to do both. You have to lead, you have to be a technical leader to understand the technology or the technical piece. At the same time, you have to lead people, which is the most complex.
Maybe even more challenging.
The most. A lot of time it's much harder because, in the technical side, at the end of the day, you might find a simple answer, or at least in science, you always find a single truth. When people, there's not one single truth. We're all different. We all want different things. We all have different ways of doing things. We have different preferences. So that's the complexity. And so how do you actually lead change is in itself is a lot of scientific research articles. It's in itself, it's a research area, right? It has been for a long time.
That is true, yeah.
And this still remains. And I think one thing we do have to be very thoughtful about is all the technology from my industry, right? If I look at pharmaceutical industry, applying technology, whether it's digitization, automation, all of this is actually aiding people. You're making your job easier. AI, there is an additional fear because now you're talking about the machine will be replacing you. So if you were a person who need to actually adopt this new technology, that is a huge challenge. That you are now trying to adopt something that's going to replace you. So just think about that. That's the challenge.
But that's kind of interesting you mentioned this, because in the software space, a lot of people say software developers face huge challenge, kind of replaced by AI. But do you see the similar thing happen in the pharmaceutical industry where AI may replace a lot of human?
I personally don't see that happening anytime soon, given the state where we are in terms of the data, the capability, and it comes down to the humans still need to either kind of verify, we don't have enough data and enough sort of training, and then the judgment of an individual is still key at this point.
So in other words, actually, people work in your industry, they still got a safe job, in a sense, compared with the software developers, things like that.
Well, yes, that's my belief. But they have to change the way how they do the work, which in itself is a huge change. Let's not forget that. They may have a job, but their job may look very different. Yeah,
that's like, I think Jensen Huang says it's the people who knows AI replacing people who don't know how to use AI.
And that's the other thing. I mean, I think we've been talking a lot about replacing. My view is we need to maybe think a little bit differently. Is it really replacing, or is it like aiding you to make your job either better or faster or more efficient? If you think of it in that context, it's not a competition.
Yeah.
And it's really how do you apply this?
Right.
Thank you for watching.